Your skin is a great indicator of your overall health. It is your largest organ and can protect you from heat, cold, germs, and dangerous substances. Sometimes changes can be an indication of a medical problem. Changes to your skin, dermatology, tonight on Call with the Prairie Doc. Good evening, and welcome to the 22nd season of On Call with the Prairie Doc, medical information based on science, built on trust. I'm Dr. Kelly Evans-Hullinger, your Prairie Doc host. Tonight we will be discussing dermatology. Thank you for joining us. In the studio this evening on the campus of South Dakota State University in Brookings is Dr. Kendra Watson from Dakota Dermatology in Sioux Falls and Dr. Mandi Greenway from Avera Dermatology, Mitchell. Welcome, doctors. Thank you for being here. Kendra, tell us a little bit about yourself. Where are you from? How long have you been in Sioux Falls practicing?
Yeah, I'm from Sioux Falls originally, and was lucky enough to be able to go back there. I've been there for almost 7 years now, and it's been super awesome. I was actually seen there as a patient when I was growing up, so it's been really, really great, and just lovely to come back and be able to take care of the patients where I grew up and in the surrounding communities. It's been awesome being back.
Yeah, and you do general dermatology, babies to elderly people.
Yes, I do.
Yeah.
We
little
do
bit of everything.
Most of it there, yeah.
Yeah, awesome. Mandi, how about you?
Yeah, so I feel like we have kind of a similar past.
Yeah.
I'm originally from Mitchell, and yes, I'm also back there practicing. And same story, there was never a dermatologist there when I was young, so it's nice to be able to provide that care for people that live in the area and that we know. So
yeah, great. So dermatology, all things skin. What's a typical day like for you in the clinic?
Yeah.
What kind of stuff do you see?
So
who sees a dermatologist?
Yeah, so as a general dermatologist, again, you see all genders, all ages. So again, a couple days ago, I saw a 1-month-old baby and a 104-year-old patient. So and everywhere in between. So a lot of skin cancer checks. A lot of people with fair skin in this area that have had a lot of sun exposure, so we see a lot of skin cancer. And then of course there's some rashes that come in, some acne, some different inflammatory skin conditions, and there's usually a couple procedures and usually a couple more rare things during the day. So it's a good smattering of everything.
Yeah, good. Well, before we start our conversation, we invite you, our audience, to submit your questions for tonight's discussion about dermatology. Viewers can contact us 3 ways. Call 1-888-376-6225, send an email to ask@prairiedoc.org, or ask on our Prairie Doc Facebook page. We will work to answer as many of your questions as possible given the time available. Sometimes we receive more questions than we can cover, and we apologize if we do not get to your question. To encourage you to ask early, all questions asked in the first 20 minutes will be entered into a drawing for our newest Prairie Doc publication. The winner will be announced at the end of this program. Your question will remain anonymous, but please provide contact information when you submit your question. So we'll just start getting to some questions. Usually we have a ton for the dermatologists to show. So we had an email question asking, what brand or level of sunscreen do I need to use on my kids? I have a child that burns easily. So let's do sunscreen right out the gates,
Totally.
Kendra. What are the important things about sunscreen?
The biggest couple of things you want to look for when you're at a drugstore, at a grocery store buying sunscreen is the number 30 or higher. 30 really blocks out a vast majority of the sun's rays, where going higher than that only gives you a little bit more protection. So 30 or higher, you want to look for something that says broad spectrum. I have young kids, and I've kind of learned that when I'm shopping for them, I want to pick something that says waterproof. That's not always necessary if you're not going to be swimming, but if you've got kids jumping in and out of a pool or sweating a lot, or just kind of running around and wiping their face, I look for something that says waterproof. I think for kids, most dermatologists would want someone to pick something that is marketed for kids. Typically those products have zinc or titanium in there, one of the physical blockers, and also usually make them more geared toward people with sensitive skin, so not as much kind of the extra ingredients that might be in some of the more fancy products that are marketed towards adults. Less fragrance, less preservative, and then more of the good stuff that will actually protect.
Great. Do you have anything to add, Mandi?
Yeah.
Do you have preference on creams, sticks, sprays? Does it matter?
I tell people it doesn't matter as long as you're getting enough on. So, I tell people if you're using a spray, that's fine, but it's not like putting perfume on. You're not spritzing. You've got to get enough on that your skin feels damp. You almost feel like you have to rub it in. I really like the stick sunscreens for farmers or people that are working outside, because they're not going to stop and wash their hands and reapply a cream sunscreen. So for them, I like a stick or a spray. But really, it's the one that you're going to use that doesn't irritate your skin, that you just kind of have to play around to figure out what works with your lifestyle.
Yeah, great. Great question. Thank you, email. We had a Facebook question. If you get a tattoo and a few years later you get bumps on it, is it infected? So I guess, what do we see as far as maybe complications from tattooing?
Yeah, so they alluded to 2 common complications, I guess. You can absolutely have an infection, so you definitely want to make sure if you're getting tattoos, you know, everything is sterile and you're doing it at a licensed tattoo parlor and all of that. Usually that's going to be fairly quick, unless it's a couple of rare, deeper infections that can show up later. A lot of times we'll see people have like a contact dermatitis, so you're allergic to something that's in the tattoo ink. And some colors are more common than others. For instance, like red is a more common allergic reaction, but it doesn't necessarily mean an infection. So yeah, sometimes we can tell by looking at it, or sometimes we have to do a biopsy and cultures to see what's going on. But yeah, there's a handful of things that can happen from tattoos.
Got it. And I assume anything that can happen anywhere on the skin could happen on the tattooed skin, right? So maybe it's kind of mysterious, yeah.
Yes, an innocent bystander. But yeah, I'd say most of the time, if it's years down the line, I would be worried about the kind of allergic contact dermatitis to specifically red ink, which is a little bit of a bummer if you got a red tattoo and then you're like, oh gosh, I'm allergic to red dye. So yeah, biopsy can help with that. And then I've actually had a couple of patients who, before trying to get it removed with a laser, we'll just inject it with steroid to kind of try to calm down that reaction, but it is a little bit of a bummer when that happens.
Okay, very good. Let's see, we had an email, a little bit of a broad question. What do you think about red light devices? Is that ringing bells for a dermatologist? I wouldn't know how to answer that question, so go ahead.
You know, I'm not a huge, deep dive in the literature about red light. I have not done that, but it's marketed for acne. You'll see like these mask devices that you can buy at Target that emit red light frequency, and then also I think it's red light that is like the low-level light therapy that's also being marketed for androgenic alopecia. These are not really well studied, so I have a hard time really recommending them, but also I don't think they're harmful at all.
Okay.
And if they give people a little bit of a sense of empowerment to kind of do that in addition to some of the more research medical care that we give, I don't really have a problem with it. But it's kind of one of those mysteries. Maybe a couple years from now we will know more and we'll have better studies that we can look back on and say, hey, it was real. But for now it's just kind of lacking. So you won't hear a lot of dermatologists leap to talk about it.
Got it. Got it. Good to know. Okay. We had a caller from Alcester who asked, how often should a 74-year-old man bathe? Caller says that their dry skin causes him to avoid bathing often. And actually I did my essay on dry skin and all the things that Mandi has said on the show over the last few years. But what would you advise this person in your clinic?
So I tell people I actually really do not care how often you bathe. I think it's more important, what kind of soap you're using. Are you using a soap or a cleanser that's really harsh, is making a lot of bubbles and really stripping those oils off your skin, and then what you're doing afterwards. So when your skin is damp, you got to be soaking that moisture in. So I tell people if you're going to take a shower twice a day, I don't care, but don't use a harsh soap. And then right when you're out, when your skin is still damp, you need to be sealing that moisturizer in with some sort of lotion or moisturizer. So that's usually what I tell people, I guess. Yeah. Good. Let's see. We had a caller ask. They're taking an eczema prescription ointment called acetonide. Are there oral alternatives? Excuse me. Guessing that's triamcinolone.
Okay.
There are oral alternatives to triamcinolone. The reason it seems like we cream and ointment people until people are sick and tired of it is because the next step that's kind of above those topical prescriptions is kind of a big step. There's always oral steroid, but that's not a good long-term management for a chronic disease. Those are kind of for special occasions only, and special meaning like, bad flares, so not so special. But the pills beyond that are kind of newer immunomodulatory agents that carry risk, including immunosuppression. They also potentially increase risk for clotting and vascular events, heart attacks, strokes, things like that. Not super commonly, but if it happens to you, it's very serious. So most dermatologists say if you can control it topically, do so. It's cheap, it's a little bit of time, but the risk profile is very low, and typically if you can, then just do it that way.
Yeah, good advice. Let's see, we had an email question. Is it safe to get Botox at an office other than a dermatologist, like a med spa? What would you say to that, Mandi? You can get Botox a lot of places these days, the dental office. Like, there's a lot of people that are able to do that procedure.
It's a really hard question, and I think it's because it's not so much the location, right? It's the training of whoever's doing it. And the hard part is that's not always really transparent. You know, a lot of people can say they have a certification, you know, to do these procedures, and a lot of times that's a very small amount of time. You know, in the realm of hours, you know, or a weekend course. And so I think it's hard. You know, I mean, I think there's some people that probably inject a lot of Botox and are very competent doing it that are not dermatologists. I think the hard part is when you know you're getting it from a board-certified dermatologist, you know they have the length of training to do that. And so I would just encourage people to be cautious, be inquisitive, be curious. You know, how long have you been doing this? What are your actual qualifications? That's what I usually tell people, I guess. Yeah, it's everywhere. So I think, being mindful about that is a good thing. Caller from Redfield says they are a 67-year-old female, developed small bumps on their forehead over the last 6 months. Is that something they should see a dermatologist about, or would you advise anything over the counter about that? It's hard to answer without seeing them. Dermatologists use their eyes and their hands, right? It's hard to...
The first thing that I thought of, you know, we're such pattern recognizers that we can almost see what they're talking about, but not quite. Common things in people who are in their 60s that show up as red bumps on the forehead, the first thing I thought of is what's called sebaceous hyperplasia. These are common, essentially normal skin anatomy where oil glands slightly overgrow and kind of form these little small red bumps on the forehead, the cheeks, the temple area. They're essentially, again, just a part of normal skin function. If I had to guess, that's what I guess you would be talking about, but the answer is if you have a concern about it, please go see your dermatologist or your primary care doctor. Yeah, good. Let's see, we had a caller from Rapid City, late life onset of Morphia, potential causes. So what is Morphia?
So Morphia is a condition. It's also called limited scleroderma. So what happens it's just in the skin if it's Morphia, where the skin essentially gets inflamed and then it starts to become like sclerotic, like it gets hard and kind of almost leathery. And sometimes it's just a small little patch. Sometimes it's multiple areas. I mean, if it's really severe, it can be almost debilitating. You know, if it's over a joint or something like that.
Because of the tightness of the skin, right?
Yeah, yep. And so the first thing we would do in dermatology is, you know, we say, is this just in the skin or is this internal as well? And so there's some lab work we do, or sometimes we refer to another specialist called a rheumatologist. But if we do determine that it's just in the skin, yes, then there's a handful of treatments that we try and kind of a treatment ladder that we do. As with a lot of conditions in skin, unfortunately, there's nothing FDA approved for this condition, and so it's a lot of this has been tried, this has been tried, this has been tried. But causes, it can show up at any time, but the main thing is you'd want to make sure it's not affecting anything internally.
Got it. Okay. Let's see. We had a caller from Beersford wondering what kind of skin cures are appropriate for peri-care with excessive itch. So talking about probably genital itching, and I guess what kind of skin conditions show up in that area? Let's talk about, I guess, let's assume we're talking about women.
Yeah, okay. Like vulvar pruritus, basically. Yeah, so there's a couple of diagnoses that can cause inflammation in the skin that can lead to itch in that area. The most common one is probably a condition called lichen sclerosis, where there's a inflammatory presence in the skin there that leads to thinning of the skin that can really, really itch. There's a cousin of that called lichen planus that can also do that, which is a little bit more inflammatory and can kind of leave kind of some architectural scarring. I'd say more common than either of those is what we call just dermatitis, which is a different type of inflammation, but oftentimes people can get dermatitis from using products, you know, using scented products, using wipes, using fragrances, using really bubbly foo-foo soap. So I think whenever I see a patient for vulvar pruritus, obviously the history is what are you using? The second part is doing a good exam. Do they have clinical signs of lichen sclerosis, lichen planus, or does it look more of a dermatitic, kind of more eczematous rash? And then really trying to get them to cut back on extra stuff, wipes specifically, feminine, you know, products that are marketed for this exact thing generally can lead to it worsening. And then a biopsy if necessary. So don't ignore it. You know, I think some people have a tendency to be like, oh, it's embarrassing, oh, I don't want to go get it looked at. But like if you're kind of miserable and it can lead to architectural changes that can impact, you know, other things, you know, that are important for that anatomical area. I think it's any dermatologist or OBGYN would be more than, you know, happy to see you and help with it. So I would say to just ask someone. Right. Don't be embarrassed because we see it all the time.
Yeah, I get that question a lot just with the population that I see, older women in my clinic. And yeah, if it's abnormal, I do send them to usually the gynecologist in our office just because I want to make sure that we get a diagnosis and treat it appropriately. There are some stakes if it is one of those things, right? So good. We had an email question. Is there anything new in treating vitiligo? So Mandi, what's vitiligo, and is there anything you can do about it?
Yeah, so vitiligo is an autoimmune condition where our body essentially attacks the pigment-producing cells, what we call the melanocytes, and so it results in complete loss of the pigment in areas of our skin. It's really common kind of on areas that get traumatized, so you know, like our hands, our elbows, our knees, our feet, as well as around openings on our skin, so around our eyes, our mouth, our genitals. And yes, there actually is one now FDA-approved cream. We have one thing that's actually made for that, which is a topical compound called a JAK inhibitor. I'll be honest, it's new, which means it's very expensive, which means that a lot of times insurance is not going to cover it, which is very frustrating. But I do try to do that. And then there are some other different creams that, again, we're working on trying to tell the immune system not to attack those cells. And so sometimes we use topical steroids, sometimes we use a different compound called a calcineurin inhibitor. Sometimes we do light therapy, which is very tricky because I have some people then think, oh, I should just go outside and tan or use a tanning bed. That is completely different and can be very dangerous when you don't have any pigment in your skin. That can cause a lot of damage. And then sometimes people use, you know, again, those oral medications, the pills that can suppress the immune system. But again, that's kind of a big jump in risk factors. So it's hard. I know there's, you know, lots of ongoing studies and hopefully we'll have more medicines soon, but that's kind of where it's at right now.
Good. Well, scalp psoriasis is an autoimmune disease that can cause thick patches of skin to develop around your hair. It can make a person's scalp itchy and can just look like dandruff. Prairie Doc reporter Sam Shower spoke to someone who's lived with scalp psoriasis since high school and how she manages it in her daily life.
Liz Shower is a freshman at SDSU, and during her freshman year of high school, she started to notice a lot of flakes on her scalp.
I noticed when I would brush my hair towards like the crown of my head, I would get a little burning sensation. And I never really thought much about it until I went to the dermatologist and I told him about it. And then that's when I saw redness and flakes.
Shower was diagnosed with scalp psoriasis, although she thinks she always had it.
I used to have a lot of like flakes behind my ears, and I would pick at it and it would start to bleed, and I never really knew what it was until when I went to the dermatologist and he looked at my scalp and peeled back my ear. He saw those flakes or scabs, and that was a sign of scalp psoriasis.
Shower says her scalp psoriasis likes to flare up in the dry winter months and the sweaty summer months. To combat this, she takes Tremfya, which is an immunosuppressant.
I take Tremfya every 8 weeks to help with the immune system, to help calm it down. I've looked into taking like pills every day, but I don't know, it just seems simpler to take a shot every 8 weeks.
She also uses a medicated shampoo as a buildup of sweat and residue can be harmful to her scalp. However, she must wash her hair every day to avoid it flaring up.
So I have to wash my hair every day because of it, and I know it's not good to wash your hair every day, but I have to do it for my scalp, and it's hard to wash your scalp without washing your hair.
Because of that, Shower says having scalp psoriasis can take a toll on her mentally.
Like throughout the years, I've constantly checked my scalp, constantly checked my hair, how thick it is, how thin it is. When I brush it, how much hair am I losing, because that is kind of a side effect.
Luckily, she has not had to go through this journey alone and has always been supported by her family from the beginning.
So psoriasis has to be something you both see a lot of in your clinics, right? We just had the last show I did was rheumatology, and so we talked about psoriatic arthritis. How strong is that link between the skin condition and the inflammatory arthritis? Like, how many people will get both? Is there a clear number?
Yeah, there is.
Yeah.
So I think it depends. Different types of psoriasis have a stronger link. So for instance, if you have nail psoriasis, it's going to be a higher risk. Or if you have scalp psoriasis or genital psoriasis, upwards of like 15-20% can have joint arthritis or joint psoriasis with it. But yeah, we definitely see it.
Yeah.
Very frequently.
Yeah. Good. Well, we'll get back to our questions because we have a lot. We had a Facebook question asking about, is there a cream or medicine to remove dark spots on my face? So let me back up because I get asked a lot about dark spots that go along with aging. So like, what are those? What are these spots that people get as they get older?
Yeah, usually they're one of mostly two things. One would be a really common benign growth of the top layer of the skin called a seborrheic keratosis. More often than not, these will have some degree of texture to them, although they can be completely flat. The other type of brown spot is what we call a lentigo or lentiginous, plural. That's a fancy name that we like to give for sunspots. You know, things that are.
You guys love your fancy.
Yes, it makes us feel very important. Yeah. So usually it's a combination of those two things. So it starts with a good exam. There are some creams that will help with lentiginous. Usually my recommendation first and foremost is a really good sunscreen, because you can do a lot of different things, but if you're not doing that, you're not going to make any improvement. So a good sunscreen, and then there's a couple different creams that can kind of fade lentiginous. If your exam is more consistent with the seborrheic keratosis, if you're really cosmetically inclined to remove those, probably the most effective treatment is gentle liquid nitrogen. So when done delicately can lead to fading or resolution of those. When done undelicately can leave white spots behind. So you got to be a little bit cautious. You got to make sure you have the right diagnosis, and you have to make sure that they're not melanoma. Melanoma on the face is not exceptionally common, but certainly something that we see pretty frequently. And so again, it starts with a good exam. The creams this person is asking about are likely related to what's called hydroquinone, which is our most common kind of bleaching cream. That's a little bit of a crude way to describe it, but it kind of shuts down melanocyte production in the skin that can lead to your routine lentiginy growth.
Got it. Okay. We had an email question about skin tags. What's a safe way to remove skin tags?
Yeah, that's a really good question. So I
How do we know it's a skin tag?
Yeah,
I guess?
exactly.
Let's make sure that's the case, right?
Exactly. Make sure that's the case. So that's hard. So I tell people, it's a good idea to again get a baseline skin exam, and your dermatologist can tell you, if it's in a really common location, sides of the neck, under the arms, and you have someone look at it and say, yeah, that's just skin tags. We can remove them in our office, but some ways to do it at home. So I really encourage people not to do like the floss trick where you tie, like floss on those. That can cause problems. I will sometimes tell people they can use over-the-counter like wart freeze-off. So a lot of times the over-the-counters aren't strong enough to get rid of actual warts, but it can help with the skin tags. But again, it's very, very important to be sure that they are actually skin tags before you're trying to do that at home.
Yeah, good. Okay. Let's see. We had a Facebook question. My teenager burned her nose last summer, and now it seems to burn really easily even in winter. Is it always going to be sensitive to the sun? So is that a real phenomenon?
I think it is I would call it a phenomenon. It's not something that you'll really see described in textbooks or when you study reactions to the sun, but I think areas that have been previously damaged kind of have a recall where they're more likely to just be a little bit more temperamental. I don't have a very specific name for it, but I will tell you that I have patients who talk about it very frequently. And it can be hard if you had a bad, gosh, I was, forgetful that one time and I got caught off guard, and then all of a sudden you're having more problems with that sensitivity. Again, zinc is where I would go, zinc in a hat.
Yeah. Okay, good. We had a caller ask, are there products you recommend for hair loss? So I guess let's talk about, you mentioned androgenic alopecia, so let's talk about typical hair loss and I guess one of those is what you're talking about, common male pattern hair loss, but also women as they get older might have thinning of the hair. What do you recommend for people?
So again, kind of coming back to the skin tags, it's really important to get a good diagnosis first, because I do see a lot of people that come in that have kind of been told that they're just having a receding hairline, or they're just having kind of, menopause, hormone-related hair loss, and it's actually something entirely different. And some types of hair loss, the later we catch them, we cannot get that hair back, and that skin is actually scarred down. So again, if you have any weird features with it, so if there's any rash on the scalp, if you have any symptoms, any itching, any burning, any pain, any rashes anywhere else, no family history, that's just really important to get checked out to make sure what you're dealing with. If we say, if it's just that kind of male pattern or female pattern hair loss, usually what I have people start with is over-the-counter Rogaine. So it's topical minoxidil. It can be effective, but I tell people it's going to take a long, long time. And I have people start it and take a picture in 6 months, and then take a picture again in a year. And you probably won't see a difference at 6 months, but you might at a year. The nice part is it's, again, pretty gentle, not a lot of downsides, as long as you're not going to get pregnant, when you're using it. But that's the main, I guess, over-the-counter I do. There's some supplements that have been described, and again, I think there's some decent evidence for a couple of them, but people can really go kind of overboard with their supplements for hair loss. I, in general, don't recommend biotin. That does not tend to be helpful for the kind of female pattern, male pattern hair loss, so I would not use that.
Okay, good. Okay, we had a caller ask, what is lichen planus and what are common treatments? So we mentioned this when we were talking about whatever other question that was. So can you go back to that?
Lichen planus is a little bit of it's a hard phenomenon to describe, but it's a pattern of inflammation where a certain type of cell called a lymphocyte comes and forms a home in a specific area in the skin between the top layer and the second layer, called the zone of lichenification, or lichen, where that inflammation forms. There's a lot of weird terminology behind it. We don't know exactly why people get lichen planus. It's a little bit of a question mark. We do have some ways of treating it appropriately. Basically, the textbook version of lichen planus is these kind of really itchy pink and purple papules on the flexor wrists, but it can be on the legs, and it can be on the back. It can be in what we call the inverse areas of the armpits or the neck, or in the groin. Topical steroids drive away inflammation, so that's kind of treatment number one. Kind of a new-ish treatment since probably we were in training is oral metronidazole. For some reason, that can block this kind of inflammation from settling in that specific area. That's not completely risk-free. It's an antibiotic, but it can be really effective in some individuals. Beyond that, probably if it's very severe and people are really interested in treating it, you got to reach for some more potent anti-inflammatory medications. Accutane can actually do a nice job of treating lichen planus, and is one that I'll reach for because it doesn't suppress the immune system. There's another medication called mycophenolate mofetil. If we had a crystal ball and we knew exactly what would work for each individual, then we would choose that. But it's a little bit of a trial and error process, and it can be itchy, it can be bothersome, it can be limited or very widespread. We don't really know exactly why, but there are some things we can try. Some studies say that lichen planus will run its course between 2 to 3 years, so if you get lucky and do nothing, it'll just go away on its own. So a bit of a mystery.
Yeah, interesting. We had an email question about hives, which can be such a difficult problem. This person said a 90-year-old who first developed hives after their second COVID vaccine and have continued to have problems with hives. So what causes hives? Yet another condition that usually we can't figure it out even, right?
Absolutely, and that's usually what I tell people. So with acute hives, so meaning less than 6 weeks that you've had this, the list of things that can trigger it is very, very long. True hives are not caused by something that's touching the skin. It's something internal, and that can be a medication, an allergy to medication, an illness, an injection. So yes, anything that's kind of triggering the immune system can trigger hives. So yes, I do see some people have hives after something like a vaccine. I also see probably more people get hives after an infection, like COVID or the flu or any sort of viral infection. So it's really hard. I tell people I don't usually do a whole lot of investigations. I'm not checking a whole lot of labs. I usually start and kind of hopefully end with antihistamines.
Yeah.
My favorite over-the-counter is probably Zyrtec for hives. But yeah, it's a lot of reassurance that we might not ever find it, but hopefully we can treat it and get rid of it.
Yeah, good. Let's see, we had a caller from Rapid City asking about facelifts and asking specifically about cold sculpting treatments as an alternative to facelift. So we're getting into some cosmetic questions. What is cold sculpting? I mean, I see this advertised too, and I don't really know what it's purported to do. What is this?
Cool sculpting is exactly kind of what it sounds like. It's cold treatment, quite very, very cold to kill adipocytes, which are fat cells. There's not a lot of things that can kill fat cells. Mostly it's just making them smaller or making them bigger. But I think cool sculpting can not only make them smaller, but also reduce the number of them. I think cool sculpting can be nice. You have for facial. I think it's maybe marketed a little bit towards this, and probably has now outrun its competitor called Kybella for kind of treatment of this area to be more effective. Facelifts can also be a really great cosmetic way. We don't do facelifts. A really good plastic surgeon can be a nice person to do it, but oftentimes whatever result you want in the cosmetic world will be best served by doing multiple things. So, a good plastic surgeon or a good aesthetic, surgeon will be able to walk you through the order of what to do and when.
Yeah, good. Kind of a related cosmetic question just from Facebook. Are there certain skin products that women should be using as they age? We'll get into this with our next roll-in, but is there something that everyone should be using?
Yeah, sunscreen.
I love it.
Yeah, for sure. There's a dermatologist on Instagram I follow, and so I can't claim the quote, but she says nothing looks better in your 50s than sunscreen in your 20s, and that is really true. So as you alluded to earlier, if you're going to be using different creams and treatments but not doing good sun protection, you are wasting your time. So that is first and foremost number one, absolutely. Depending on your age, we're seeing a lot of young people, be influenced kind of by social media and getting into really intense skincare regimens. If you're a teenager, you do not need to be using all of these anti-aging products. That is not necessary. But as we get into 20s and 30s, again, it depends on your type of skin. If you have more of this type of skin, some recommendations might be harmful for you. So I'm kind of hedging, but moisturizer, gentle cleanser, lots and lots of sunscreen, and then again, you need to talk to somebody that can look at your skin and tell you what you need.
Yeah, good. On that note, between social media and television, products for your skin are everywhere. Do they actually work, and how do we know if they're safe? Prairie Doc reporter Sam Schauer spoke to our studio guest, Dr. Greenway, about some of these products and their safety.
Collagen, retinol, biotin, and vitamin C are supplements that are advertised every day for people's skin and health. And Avera Health dermatologist Mandi Greenway says most of these products don't do what they're advertised for.
Anything over the counter is going to, in supplement-wise, is not going to be regulated by the FDA. It's not going to be studied with the same rigorous, studies that our prescription products have. And so it's hard to know not only what they're going to do for you, but also if they're really containing what they say that they contain.
Collagen is the first big supplement Dr. Greenway hears about. Collagen claims it hydrates the skin and gives it elasticity to stop wrinkles from forming. Dr. Greenway says it depends on which collagen people use, but there isn't enough data yet.
And so I think there's some promising early studies. I usually tell people I don't think it's going to be harmful. I don't know that the data is quite there yet, but in the realm of supplements, it's probably an easy and safe one to take.
The next supplement is retinol, and Dr. Greenway says this over-the-counter supplement is a cousin to the prescription medicine retinoid. Retinoid is prescribed to help with acne, but also helps with wrinkles and sun damage. However, Dr. Greenway says retinol has the most supplement data for its effectiveness, but is still not as strong as retinoid.
The prescription retinoid is going to be much stronger than the over-the-counter retinols and retinols.
Biotin is the next supplement, and Dr. Greenway says this product should be avoided. Biotin helps with nails and hair and is great for hair breakage, but not for hair growth. In fact, Dr. Greenway says that if too much biotin is taken, it could cause harm to the body.
So it can actually interact with some lab tests, specifically for some like heart lab tests, as well as some thyroid lab tests, and it can interact with medications. So this is another example of how supplements actually can be dangerous for you.
The last product is topical vitamin C, which is a cream for your face. This cream helps mostly with skin tone and color and can reduce redness and dark, sun-damaged skin. Unlike the others, Dr. Greenway says this one actually works great.
There's lots of different preparations, and you can go from, the very reasonably priced to the very, very expensive. You do not need the really expensive. So I usually, have a couple of brands I recommend to people, but more so it's not to break your bank. The cheap ones can do just as well as the really expensive ones.
Dr. Greenway shares that these companies prey on people's insecurities, and you don't need to buy every supplement. She also shares that aging is just sun-damaged skin, and wearing sunscreen early and often will help you age gracefully.
I always tell my patients, nothing looks better in your 50s and 60s than sunscreen in your 20s. So you really need to use sunscreen, and that's the most important thing you can do.
We're just remarking on that statistic that was shown there about how much people spend on skincare products. We don't have to do that, right?
No.
Must
I'm
we?
like, I don't.
No,
Yeah.
we must not.
Okay.
No.
Yeah, it doesn't have to be fancy.
No.
Right? Moisturizer, sunscreen, unless there's something else going on.
Yes.
But, okay, good. We got plenty of questions, so we'll just get back to it. We had a Facebook question. Is there a reason my eczema is more found on my calves than any other part of my skin? So I guess let's back up, Mandi, and just talk about eczema since it's so common. Like, what is eczema? Where do we usually see it? And what would you say to this person?
Yeah, you bet. So eczema is kind of a generic term. There's several different types of eczema, and there's kind of the type that we think of like with little kids, but we can get it at any age. That's more genetic, and that kind of goes along with allergies and asthma, can run in families as well. And then there's type that happens just from really dry skin, and there's types that can happen from, allergies to something you're touching on the skin. So what they were describing is likely something called nummular eczema would be my guess. So nummular eczema is a type of eczema that we can have a genetic component to it, but it often shows up as people's skin gets drier. And so, the further away from our heart, the lower legs tend to get really dry. So that might be why it always shows up there. There's another type of eczema that we can see in people that have chronic swelling in their legs. It's called stasis dermatitis or stasis eczema. So there's a couple different types, but it really depends on kind of what type we're dealing with and where it's found.
Yeah, good. Let's see, we had a caller from Brandon who asked, do you recommend Dove exfoliating soap or others? Do you have patients ask you what kind of soap should I use, and what's your general advice, Kendra?
I don't typically recommend exfoliating soaps. They can be really abrasive and just irritating, honestly. I don't mind Dove as a brand, all in all. I think they do make some nice unscented, gentle products. So I actually do like Dove. But I think everyone should be catching up on a theme here. Like, the boringer the better. Like, the less fragrance, the less foo-foo stuff that's in it, including exfoliating beads and things that soap a lot. There's a reason why you walk into your dermatologist's office and see CeraVe and Vanicream posters all over, is because that's what really treats the skin with a lot of gentleness and does a good job of the roles that it plays, moisture and cleansing and otherwise. So Dove, not bad, but I would pick an unfragranced brand that is not an exfoliant.
Yeah, nice. Okay. Let's see. We had an email question. I have small bumps on my hands and fingers that turn to sores. They can get painful and then go back to bumps, but they never go away. What could this be on the hands?
So, again, as we talked about, it's hard to say for sure. One thing that it makes me think of is something called dyshydrotic eczema, which is it's a another type of eczema where it forms like little, almost like blister bumps, and then it can kind of peel away, but they keep coming. That's usually found like on the sides of the fingers, the sides of the hands, but can be on the palms as well. But yeah, I mean, it could be benign little growths, it could be little warts, it could be
Granuloma annulare likes to do that on the knuckles, kind of purple bumps that don't typically go away. Yeah, you'd show a picture to a dermatologist, they'll know in a second. But if you describe it, it's harder.
Yes, I know that from experience. I love sending pictures to my friendly dermatologist. Okay, we had a caller ask, is Vicks Vapor Rub an effective, they say scalp treatment, but I feel like Vicks Vapor Rub has this whole lore behind it. People use it for a lot of things. Is it effective for any skin conditions?
There's a really interesting study in the British Journal of Dermatology from maybe like 8 or 10 years ago, and it goes over all the treatments for warts, and there's 99 of them. So when 99 things are being studied for warts, none of them work very well. But Vicks is one of them. But so is just like mildly hot water. There's all sorts of things in that study that kind of gave me a good chuckle. But I think that there probably is some truth behind it as far as what toenail fungus is and warts are concerned. But it is more lore than anything. Again, like no one's funding research to like look into these things, so it's just kind of interesting.
Yeah. Is it a petroleum jelly base in Vicks? I mean, does it give you
know.
moisturizer? Like it might have stuff in it that
I
helps
think
some
that
things,
too,
but yeah.
Sometimes when people come in and they've tried some of these treatments, I'm like, honestly, you're probably just using moisturizer on here for the first time, and that's might be helping more than anything.
Okay. Let's see. We had an email question. How do I tell if my mole should be checked out by a dermatologist? So I guess let's talk about moles and what makes them concerning. What are the features that you would look for in a mole that would concern you?
Yeah, so what we describe is something called the ABCDEs of melanoma: like asymmetry at the border, the color, the diameter, and evolution. So how's it changing? So I usually tell people, if you look at any of your moles and you pretend to cut it in half in any direction, if it's different from side to side, different color, different shape, it should just be checked out. We don't expect you to be the experts in if these moles are abnormal or not. How things are changing is the most important. So that's why we encourage people to try to look over your skin, and again, the more you do it, try to do it once a month and just take a moment to look at your skin. You'll start to notice if things are changing, and if you notice that, then you need to let us know. Anything that's causing symptoms, if it's hurting, if it's bleeding, those are definitely warning signs.
Yeah. And in some places, it's not just that easy to be, like, I'm gonna go see the dermatologist about this mole, right? We don't have enough of you. So starting with your primary care provider is always a good place, too. So, good. We had a Facebook question about a red mole. She says her mom had some of these all over her body when she got older. And she's starting to see some of these, and should I be worried? So I guess, you want to make some guess?
Yeah, probably they're cherry angiomas.
I have one right
little benign vascular growths of capillaries. And people, they're kind of genetic in number. Most of them are on the trunk. These are, to be human is to grow cherry angiomas. So likely they're fine, but again, it's, there are some other red bumps that aren't so fine, so you just want to get them checked out. But
yeah, good. Some of these common things we see a lot of and can put your mind at ease pretty quickly.
Yeah.
So let's see. Caller asked, when should I get my skin tags removed? So we talked about skin tags before. Like, do you have to take them off?
Not at all. Nope. So if I tell people, if they bother you, if they're getting caught on your clothing and they're hurting and bleeding and getting in the way, well then it's very reasonable to remove these benign things. But if they're not, absolutely not. You don't need to. Again, if they're changing and hurting and bleeding, you want to make sure it's not something that's dangerous. But if they're just there and you don't need to do anything.
Good. And they can grow back. I mean, even if they're in a place where you're getting friction. I would say you can get those removed, certainly at the dermatologist, but almost any primary care doctor is willing to do that for you too. Okay. We had a caller ask about calluses, how to remove hard calluses. So I guess the most common place I see this is on the feet, probably. What do you tell people, what advice do you give people about calluses?
I first kind of question whether or not we need to treat them. Calluses kind of form for a reason. Usually it's to protect our skin from force. We can think of our skin on our heel as thick for a reason because we're walking on it all the time, and it gives our bones of our feet and our skin some protection. So we don't always have to treat calluses. If they're painful or cosmetically, if you don't like the way they look, I'm not one to pumice them down. You know, physical exfoliation can actually promote that thickening response. So if you want to chase after it a little bit, usually I recommend a keratolytic, which is a topical cream like CeraVe SA, which has salicylic acid in it. I'm a big lover of amlactin, which has gentle lactic acid in it, and these can kind of promote the skin from not getting too compact in any one area. But mostly I would say calluses are normal, and it's hard to fix normal, and try to keep it if you can. But if it bugs you, to either pick one of those two kind of exfoliating creams and see if you can, you know, just make it smaller.
Yeah, and I feel like I see this a lot when people maybe have a deformity of the foot and they have abnormal friction in a location. So we involve the podiatrist a lot with
like a
callus
corn. So
formation.
corn, you know, they've got that painful core, which can be painful, and that's all about pressure offloading. You know, you can't get rid of that bony growth, and feet are really complicated. So pressure offloading with a little bit of keratolytics, and then just realizing that it's going to be something that might need some TLC from time to time.
Yeah, might need to adjust your footwear in some cases. Okay. We had a Facebook question. What is your take on unscented goat milk soap? It's pretty specific. Probably not, you're not going to find a randomized controlled trial about goat milk soap, I assume. Yeah,
it's another one of those. You know, if it works for your skin, I think that's fine. Would it ever be something that I would like recommend necessarily to a patient? No. Again, sometimes a lot of our skincare products, again, if they're not causing skin problems, are personal preference, and if it works for your skin, that's great. But probably not what I'm going to be recommending.
Yeah, good. So we are in our last minute. What are some common summer skin conditions that we should be on the lookout for? Summertime things.
I would just say the big one is as the spring comes, like just wear your sunscreen. We can see a lot of sun allergy. Sun sensitivities this time of year, and also like allergies, you know, so if you feel like, you know, take your antihistamines. I don't know, that's a total generalization, but it's all about the sunscreen.
Something to see here.
One more plug for sunscreen before we go. We wouldn't be a dermatology show without that, but good. Well, thank you both so much. Our winner for the prize tonight is Beth. Thank you, Beth, for asking a question during the first 20 minutes of the show. A gift will be sent to you. We'll be back after this.
Searching for trusted medical information or looking for a doctor for your medical needs? Head to the Prairie Doc YouTube channel today to access previous On Call with the Prairie Doc episodes. And make sure to join us most Thursdays on SDPB or streaming on our Prairie Doc Facebook page.
An exceedingly common question I get in the clinic, especially in the heart of a South Dakota winter, is how to remedy dry skin. And the questions aren't just in the clinic. My own kids, family, and friends, everyone seems to have an occasional problem with dry and irritated skin. Dry skin is something we are all familiar with. If your dry spots come with a rash or anything else unusual, it may be worth showing it to your primary care provider, as it could be something else entirely. Eczema, a common inflammatory skin condition, often goes along with and is made worse by dryness. Soothing your dry skin doesn't have to be fancy or expensive. There are a handful of tricks we can all use to help ourselves when it comes to dryness. The first advice is to avoid things that cause your skin to become drier. For many, that means to bathe less. That's right, I said it, bathe less. Every time you bathe or shower, it washes away natural oils on the skin. Often our instinct when our skin becomes irritated is to wash it more, but in this case, more is not better. Of course, I'm not asking you to forgo hygiene entirely, but most people can probably bathe every other or every third day. This is especially true of babies and kids who struggle with eczema. Cut down the daily baths. When we do bathe or shower, we can modify factors that will worsen dry skin. The hotter the water, the drier the skin afterward. So try lowering the temperature a bit. Less time spent in the bath or shower can help. And be mindful of the soap or cleanser you use. To reduce dryness, use less soap and a gentler soap. For kids who love the tub, skip the bubble bath and just put some gentle soap on a washcloth at the end of the bath when it is time to wash up. After that bath or shower, how do you choose from the hundreds of creams or lotions out there claiming to soothe dry skin? The dermatologists I know love products with petroleum jelly, like Vaseline, for dry skin. Remember, I said this didn't need to be fancy. Stick with fragrance-free products and keep it simple. Whatever you choose, slather it on as soon as the skin is dry. Dry skin affects many of us, but I hope these tips will help the next time you find yourself irritated with this common condition. Thank you so much to our guests, Dr. Watson and Dr. Greenway, for volunteering their time to help us learn more about taking care of your skin. If you would like to see and hear more episodes of this program, please like and follow us on Facebook, Instagram, YouTube, and TikTok, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper and online. Listen to us live every Wednesday morning at 9:30 on KBRK Brookings. And be sure to look for the podcast of this program, Prairie Doc On Call, wherever podcasts can be found. From all of us here at On Call with the Prairie Doc, thanks for joining us for another episode of health information based on science, built on trust. Until next time, stay healthy out there, people.
This week, we host one of our viewers' favorite shows, Ask Anything. Next time, On Call with the Prairie Doc.
Hello, my name is Dave Heinck, and I've been a board member at Healing Words Foundation for the last 9 years. Well, my background goes all the way back to DeSmet, South Dakota, where Rick Holm and I were childhood friends. We were at USD together, and we've managed to stay close friends for our entire lives. And I spent the bulk of my career with Weyerhaeuser Company in the Pacific Northwest, and I led their production forestry research group. I also spent time on the faculties of Auburn, Virginia Tech, Purdue, and affiliate faculty positions at University of Washington, University of Idaho. And in retirement, I've spent most of my time in the nonprofit world in board service. When Rick and Joni were putting the foundation together several years ago, Rick would call and ask a question or two, and I usually had the answer, or at least where he could go. And so eventually, he and Joni invited me to be a member of the Healing Words Foundation board, and that's how it happened. The foundation and the Prairie Doc media production is really committed to truthful, timely, tested medical information. And there's a lot of information out there now that's either half truth or no truth. And of course, being a scientist by profession, we're always seekers of truth, understanding full well that the truth can change with additional research. Every dollar that's pledged or given to Healing Words Foundation unleashes an army of volunteers. The foundation and the Prairie Doc Media puts out really good stuff, very useful things. So there's a high return on the investment to invest in the Prairie Doc. For more information or to donate, head to www.prairiedoc.org or send your donations to Post Office Box 752, Brookings, South Dakota 57006. Thank you for support.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Ophthalmology Limited, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health, Dakota Dermatology, Vance Thompson Vision, Black Hills Medical Society, Brookings Madison Flandreau District Medical Society, Pierre District Medical Society, Sioux Falls District Medical Society, Yenton District Medical Society, Orthopedic Institute, Aberdeen Asthma and Allergy, South Dakota American College of Physicians, Cool Beans Coffee, Lake Poncet Sailing Academy, and Swiftel Communication.